Thank you for joining us for today's second webinar of our PARMA COVID conversation series, COVID-19 Safety and Employee Considerations. We're pleased to present these webinars providing topic-specific conversations on the various aspects of dealing with the pandemic. The PARMA community consists of many different types of agencies and operations, and they all have their unique challenges. The goal through these webinars is to help public agencies and others be confident in their response decisions. Thanks to PARMA for partnering with us, and we're happy to be here today. Presenting today will be FACS Director of the Bay Area region, David Brinkerhoff, who's a certified industrial hygienist with almost 20 years of experience within the environmental health, industrial hygiene, and hazardous building materials consulting community, as well as FACS project manager Malek Alaouie, who is a certified indoor environmentalist with 10 years of experience in indoor air quality and infection prevention and control. Both David and Malek are also key members of the FACS COVID-19 emergency response team. But before I hand it off to David and Malek, I'd like to quickly cover a few components of the webinar platform we're using today, GoToWebinar. Everyone is in listen-only mode, but this does not mean that we can't hear you. As you think of questions that you have for our presenters throughout this webinar, please enter them in that question box that you see in the control panel on your screen. Choose Send Questions to Staff or Panelists, and we'll have time for a question and answer session following the presentation with about 10 or 15 minutes left. And with that, I'll hand it over to our presenters.
Thank you, Taylor. Well, I'd like to start. Well, first of all, thank you all for attending. We appreciate your time, and hopefully we can provide some information. I know there's a lot of webinars on this topic, and hopefully we can provide something that's a little new and different. As Taylor mentioned, this is a continuation of the webinar we did last week. Last week, a few of my colleagues presented on facility considerations, and today Malek and I are going to talk about more employee considerations. I always start these with a disclaimer that this is a new and emerging issue. Things change all the time. By the time we're done with this webinar, this may already be dated. There may be new guidance from the various agencies that are involved. Also, I would just say we're not doctors, so we don't practice medicine. We're going to talk a little bit about health considerations, but for specific questions related to medical issues, you should always go to your doctor. And keep up to date using the best resources. So generally, we're focused on guidance provided by the CDC, the WHO, State of California has a ton of good resources, and then maybe most importantly, your local health agencies, which oftentimes have different and sometimes more stringent requirements. I'll just start by talking a little bit about industrial hygienists. I've been married for 17 years, and I'm not sure my wife still knows what it is that I do. So I like to try to explain a little bit about industrial hygiene. We function in the world of exposure. So our job is to evaluate exposure and to protect people from exposure. Now, that exposure can come in a variety of different forms. We break it up into chemical, biological, and physical exposures, typically. So our chemical exposures, those could be things like formaldehyde in a lab, or they could be welding fumes, or those types of things, asbestos. Physical exposures might be heat, cold, vibration, radiation, that kind of stuff. And biological exposures could be things like viruses, or bacteria or mold, those types of things. So our job is really to evaluate those exposures and to help protect people from those exposures. And as part of our mission in doing that, what we really try to do is create experts. And what we're talking about is not just ourselves, but also our clients, the community, the public. So education is a huge part of our mission in protecting public health and the environment. Today, here's what we're going to talk about. We're going to review sort of the real basics about COVID. This was also talked about last week, but we're just going to reinforce some of those basic things about COVID. And then what we're going to really focus on is safe work practices, safe work plans. If you're here in California, one of the main tenets of the guidance documents, and oftentimes a requirement at the county level, is that you do a comprehensive risk assessment and you develop a plan to protect staff, the public visitors. So we're going to go through the various elements of what we think makes up a good COVID-19 safe work plan. And so back to basics. What are we talking about? This is a virus called SARS-CoV-2. And the illness is called COVID-19. COVID meaning corona, VI meaning virus, D meaning disease, 19 the year that it first became an issue. Coronaviruses are not new. We've dealt with coronaviruses many times. There's been other pandemics in the past. You may have heard of SARS, you may have heard of MERS. These are other coronaviruses. Also, there are somewhere between 4 and 7 coronaviruses that are very common in the world that are responsible for a lot of our common colds. So this is not a new virus, but it is a new type of coronavirus that's impacting humans. This particular virus is transmitted primarily through respiratory droplets. So I cough or I sneeze or I talk closely to you, and the droplets come from my mouth into either your mouth, your eyes, your nose. So when we talk about droplets, these are fairly big things, much bigger than the virus itself, certainly. And these things are subject to gravity, right? So if I cough, those droplets leave my body, and in a relatively short period of time, they're going to land on a surface. So this is really the primary way we think this virus, or I should say the doctors think this virus is transmitted. This is why there's so much focus on maintaining physical distancing, on wearing your mask. Excuse me. It may also be possible to transmit this virus from surfaces. So if I cough, like I just did, on my desk, and somebody else touches my desk and then touches their face, that can also be another route of transmission. We don't think it's the primary route of transmission, but we can't say it's not an issue. And then I'll just add also, you may have heard recently, there's been a lot in the news about aerosol transmission. And so when we talk about the difference between respiratory droplets and aerosols, what we're really talking about is size. And what's important about size is how long those things can stay in the air where somebody else can breathe them in. So as I mentioned, respiratory droplets tend to settle out of the air pretty quickly. Aerosols, being much smaller, tend to hang around a lot longer. You can think of them more like smoke. They behave kind of more like smoke. They're so small that they tend to float around and remain airborne for a much longer period of time. Droplets may be airborne for minutes. Aerosols are probably airborne for hours or maybe even longer. So again, at this point, the science still points to droplets being the primary route of transmission, but we can't discount aerosol transmission or surface transmission. This is a graphic that I like to share. We hear a lot about 6 feet, maintain 6 feet of distance. Well, why 6 feet? That's not a magic number. And in fact, it's not the number that was always used when talking about physical distancing to prevent the spread of viruses. In the past, we used 3 feet. But there's nothing special about that number. You're not safe at 6.5 feet necessarily, but it's kind of a good, it's a good place where, you know, a lot of the respiratory droplets are going to have settled out in that distance. But the smaller ones, from sneezes, these types of things, can go much further, you know, maybe 20 or 30 feet. So this is just why it's really important, why there's so much emphasis on the wearing of masks. The more we can control those respiratory droplets at the source, the shorter distance they're going to be able to travel, and the more effective maintaining that physical distancing is going to be. As industrial hygienists, this is what we call the hierarchy of control. This is the way we look at exposures and try to control them. What you'll see here is at the top, we start with elimination. That's really the most effective way we can control any kind of hazard. So if I'm concerned about asbestos, if I eliminate that hazard, there's no longer an exposure concern. So that's very effective. Substitution is something we see a lot, you know, maybe in industry. If I have a very toxic chemical that I need for a given process and I'm able to substitute it with a less toxic product, then that reduces the potential for exposure to employees or the public. Those two things we can't do with the virus. We can't eliminate the virus. and we can't substitute it with something else. So we move down the pyramid to things that may be less effective, but still effective. Isolation, this is the basis of the shelter-in-place orders. We're trying to isolate people from the hazard, which in this case is other people, other sources of infection. As we start to come out of shelter-in-place, and that's all over the place depending on where you live, now we start to look at these bottom two controls. These controls aren't as effective, but as we come out of isolation, this is the way we can protect people. So our administrative controls, that's what we're talking about today primarily. How do we change people's behavior? How do we make them safer in the environments that they work in or they visit? And then we'll hit a little bit on PPE. PPE is generally considered the least effective measure for a couple of reasons. PPE are things like respirators or gloves, that kind of thing. And we generally consider them to be the least effective because they completely rely on the wearer. My respirator only works if I shave my beard this morning and I put on my respirator correctly and I'm taking care of it correctly. So it puts all of the all the control for exposure onto the individual rather than the company or the employer. I do want to point out too, there's a lot of guidance out there, so I do want to direct you towards some of the reliable sources. There's a ton of information out there, and there's a lot of misinformation out there. Get your information from good sources. We rely primarily on the CDC. California has their Resiliency roadmap program that provides industry-specific guidance, so you can go to that website and you can look up, what do I do if I have an office? What do I do if I have a daycare? What do I do if I am an agricultural worker or company? So there's a lot of really good specific guidance there. And all of their guidance starts with the same two things. Comprehensive risk assessment, look at your building, look at your facility, look at your task and assess the risk, and then development of a written plan. How are we going to now mitigate this risk to the extent we can? And then also, your local public health agencies, almost all of them have public health orders that may be more stringent than the state or federal guidance, so it's always good to be up to date on the local websites. And at this point, Malek's going to start to talk about how we deal with these outbreaks in general, and then more specifically how a plan is created.
All right, thank you, Dave. Hello, everyone. 5 months now into the pandemic, and we've witnessed a lot of mandates, orders, and change in opinion. But basically, in the life of every pandemic, there are mainly 3 approaches to fighting the pandemic: containment, control, and prevention. Now, containment is a reactive approach, and it's a collaborative effort. It's mainly based on communication across stakeholders. And it begins with identifying the hazard of the disease, either through diagnosis or testing. And then after we identify a case, we initiate response, which is contact tracing, isolation, quarantining, and cleaning and disinfection. Control is an effort to reduce the risk of transmission of any disease. It is proactive when the disease has already started. It is a collective effort between individuals, so collective individual effort. It involves source control, since humans are the source of the hazard. Source control features face covering and some level of personal protective equipment. It also involves engineering controls, such as installing physical barriers, upgrading your HVAC system if it permits. And what we'll be focusing on in this webinar is the administrative controls or workplace controls, including active screening, staggering work shifts, and modifying some of the tasks. Now, the prevention element is mainly behavioral, and it's really an individual effort. The elements of the prevention are hand hygiene, what you're now familiar with, personal cleaning and disinfection, physical distancing, wearing your face mask or face covering, and self-screening, which we're gonna discuss and talk about shortly. Now, whenever a pandemic starts fading, controls start relaxing. However, the prevention element is ongoing, and this is something that, if it were practiced, it was practiced by people continuously, then we may not have, had to go through all these spikes and high number of cases. Next slide, please, Dave. Now, every safe work practice plan has some kind of roles and responsibilities assigned to it. This diagram actually summarizes the interaction between different stakeholders in any kind of location or any type of business. Now, the safety coordinator is responsible for implementing the whole safety plan and supervising the individual implementations. The core safety team is a group of individuals who monitor all the changes out there and update the provisions of the safety program. Now, every department has a representative, which is part of the extended safety team, and it's some sort of bridge between the core team and other employees. Now, the actual implementation of the site safe work practices falls on the supervisors. So they should implement the site-specific work practices. They should train other employees or their subordinates on area-specific safe work practices. They should frequently inspect the locations they supervise and report any gaps and any required corrective measures. Now, employees are required to follow all the safe work practices. They are required to communicate any observed hazardous conditions, and they should communicate any observed incident, any symptoms, or any kind of exposure. Any employee who is arranging some sort of work with outside parties, such as vendors and visitors, is required to communicate the safety plan and the global safe work practices to vendors, outside contractors, or visitors, and make sure they acknowledge the elements of that plan and they comply with it.
So, Malek, would it be safe to say that the implementation of a safety plan takes involvement from everybody at all levels?
Absolutely. So this is the kind of collaboration that we were talking about. And I'll hand it to you, Dave.
Yeah, so talking a little bit about, so what we're really talking about is how to build a plan. And as Malek said, it takes engagement at all levels to get people to work within the plan, to comply with the plan. What I'm going to talk about a little bit now is how, kind of the meat of it. How do we actually do this? And what I'm going to share is our approach to it. And it starts by conducting a hazard assessment or a risk assessment. And we do that on the basis of maybe a building, a type of occupancy, or maybe a task. So I may go into a building and look at the way the building's set up, look at the different things that happen in that building, and we can assign different levels of risk to those different areas of the building, or maybe it's by tasks. And then we're going to talk a little bit about how we implement specific safe work practices. This is our approach. We try to keep it simple and color code things. So as I walk through a building, we're typically going to identify private workspaces as our green areas, and in those green areas you've got certain safe work practices. You've got to maybe clean your own things. Maybe we talk about the use of a portable HEPA device. In those areas we can generally take off our masks if we keep people out. Yellow are common areas, so break rooms, kitchens, conference rooms, those kind of things. There's a different strategy for reducing risk in those areas. Maybe it's limiting occupancy of a conference room so that people can maintain their distancing. It has to do with what kind of schedule do we need to implement for cleaning and disinfection. Our orange areas, these tend to be more specialized areas. Maybe for some reason we can't keep people separate because it takes 2 people to complete a task. Green, yellow, orange, these are all staff areas, and then we identify purple areas for public. Light purple being kind of transient areas where the public may walk through. The public's difficult. We don't have a lot of control over the public, so we need to put in practices that make it easy for them to do the things we need them to do. And then dark purple, these are more specialized areas. Again, maybe it's a publicly accessible conference room, maybe it's a restaurant where some different types of practices to be put into place. So this is our approach to doing risk assessment. It's not the only approach, but we found that by making things simple, color-coded, using icons, it makes it a little bit easier for people to comply. I won't spend any real time here, but here's just kind of a decision chart of how we work through our risk assessment process. And then this is just kind of a quick summary of what's different about all this stuff. So again, green, yellow, orange, these are different risk levels or different risk areas for staff areas that an employer or a building owner can control. And then the purple and dark, or the purple colors are public areas where it's a little bit more difficult to control because we have people coming in from the outside, the public generally. And I'll just add that you know, one of the really important parts about trying to make this process simple and understandable is that we have to train people to this. They have to be able to understand what a green, what a yellow makes. So we don't go into a lot of detail on that in this presentation, but training of staff is a really critical part of this. And it's usually not a one and done kind of a thing. You've got to train, you've got to reinforce, you have to audit to make sure that people are doing these things that we need them to do to reduce the risk for everybody, for the people surrounding them. So we'll go into some specific areas. I think we mentioned this, but all of those color-coded areas, the safe work practices associated with them all address the same 5 basic issues. Malek, you can walk through those.
Yes, sure. So as David mentioned, the safe work practices and the risk assessment that we conduct for every location is based on 5 infection prevention elements: health screening, physical distancing, personal hygiene, protective equipment, and environmental cleaning. Now, health screening is actually the first, well, it's your first line of defense as an employee and a business. So if you monitor your health prior to going to work or entering a building, then you can mitigate a lot of challenges or avoid some consequences. The CDC has provided a very easy self-checker on their website where you can actually, it's a list of questions, and you can it shows several different types of symptoms, and this is an example of that self-checker. So you basically ask questions about your location and whether you are inquiring about yourself or someone else. It also it starts with the list of life-threatening symptoms before it goes to the common symptoms. And if you check no to any of the symptoms and answer no to any of the questions, then the self-checker will tell you to that you're good to go. And if you check yes to any of the symptoms, it'll ask you to follow some guidelines and to seek medical attention.
And I would just add that this is one of those areas where employers have a lot of challenges, right? How do we medically screen people? You know, are we now creating medical records that have to be stored in a certain way? You know, Malek's going to talk a little bit about temperature checks. You know, is that a medical procedure? You know, there are HR considerations, there are legal considerations. So this CDC self-checker is kind of a nice way to bypass a lot of that by requiring people to go through this process daily or before they enter your building.
So an employer may choose to conduct in-person health checks for not only employees, but any outsider that comes into the building. However, safety is often an issue here. So the person who is assigned to conduct the health screening should be provided with some sort of either physical distancing, some engineering controls, or PPE. Now, it is important to maintain confidentiality across the whole process as per the U.S. Equal Employment Opportunity Commission. And you can visit their website to see the do's and don'ts of conducting an in-person health check. Now, temperature checks is a part of the health screening process. Now, if you're relying solely on physical distancing, you may ask the person to take their own temperature and confirm that it is below what CDC consider as fever, which is 100.4 Fahrenheit or 38 degrees Celsius. And there's no PPE requirement if you are placed standing more than 6 feet from the other person. Now, if you're relying solely on barriers and partitions, then make sure that the person taking the temperature is standing behind the barrier, and they just have to extend their hand around the physical barrier to take the temperature. Now, there are two types of thermometers out there. You have the temporal, where you have to swipe on the forehead, and you have the non-contact infrared thermometer that is more common. And there are some caveats, associated with using this kind of thermometer. Basically, it has to adapt to the environment you're using it in. You have to place it in that environment 10 to 30 minutes before turning it on. It doesn't require you to change gloves between each check, since you're not touching or you're in contact with the other person. But it does require frequent disinfection using alcohol wipes, at least 60% ethanol or 70% isopropanol. Now, if you're relying solely on personal protective equipment, you should at least use a combination of a face mask and some sort of eyewear protection, either goggles or face shield, and that if you're standing within 6 feet of that person. And you have to dispose of PPE and practice hand hygiene after each or several screenings with no physical contact.
So if you make the decision to take the temperature of your employees or the public, there are a lot of things to consider.
Yeah, absolutely. So physical distancing is not only standing 6 feet away from a person. It is actually also avoiding crowded areas or settings, learning to prioritize in-person meetings. So learning what a 6 feet distance is not enough. You should know that reducing occupancy and interaction is one of the major more important prevention elements. So stand six feet away from people, reduce need for physical interaction, discontinue non-essential in-person meetings, and of course, non-essential travel. Now, some states and local health agencies are starting to mandate quarantining for travelers from outside their states. So non-essential travel should be avoided when possible.
There's a lot that can be done here with the physical environment. So one of the places we see a lot of people focusing is can I take a bunch of chairs out of the conference room? Can I put up some barriers at the reception desk? Can I spread out the desks? So modifying the physical environment becomes an important part of this as people go back to work. And then also, just to reiterate once more, that 6 feet number is not there's nothing special about that number. It's just the guidance, and being at 6.5 feet doesn't necessarily protect you.
Now, personal hygiene should be a habit and not really a mandate or an order. So frequent hand washing, the priority is using soap and water whenever you have access to that. And whenever you don't have access to soap and water, then you should sanitize rub your hands, mainly using alcohol, alcohol-based hand sanitizers. Again, 60% ethanol or 70% isopropanol. Respiratory etiquette is also an important habit. So how to sneeze and cough, well, either using a tissue or into your elbow. Now, personal items should be reduced. The fewer personal items that you are exposing, the better, because you have to individually clean each of these items. They're basically the extension of your hand, and you should avoid placing them on common surfaces.
How many cubicles have you seen recently that are full of knickknacks and things?
Yeah,
creates a challenge.
Now, protective equipment. Face coverings, as industrial hygienists, face covering doesn't really fall under personal protective equipment. It is some sort of protection to the public. It reduces, to a certain extent, the amount of droplets that you will be transmitting or emitting, whether from a cough or sneeze or from yelling. So examples of face coverings are either surgical, paper, or cloth masks. And the CDC has some guidance on how to make your own homemade face covering. They must be worn at all times, and they should cover both the nose and the mouth. We've seen a lot of people just covering their mouth because they can't breathe. But actually, the respiration, like inhaling and exhaling, does emit some sort of droplets, not to the 6 feet range, but we call this the droplet-borne route. This is why it is important to cover your nose as well as your mouth. Now, if no other person is present in a closed locations, and now we've seen a lot of cities are coming up with some conservative approach to wearing face covering. So if you're some cities if you're in a cubicle that doesn't have high walls or not enclosed, then you are required to wear face covering. It hasn't been adopted by all counties or cities, but they're looking into forcing face covering in what they consider as an open area. Now, personal protective equipment is either voluntary or it is required by certain tasks. If you're requiring your employees to wear personal protective equipment and special respiratory protection, you should have a respiratory protection program in place. You should, all your employees that are required to wear the respirator should be medically screened, and you should fit test your employees frequently. Now, other types of PPE are gloves. Mainly gloves are used during cleaning and disinfection. They don't actually reduce the risk of transmission or contamination. They can get as filthy as your hands. But because they come in different colors, they can be as a reminder not to touch your face or nose or mouth. But we mainly recommend those during cleaning and disinfection, and any additional PPE that is required by the safety data sheet of any product that you're using. Face shields are not a typical replacement for a face mask, but it is an additional barrier as considered more of an eyewear protection. It's not a mask.
And I would just add that, respirators at this point are really limited to people that have high risk, people that are working in healthcare. But we do have employees that have gotten a hold of the 95 respirators and want to wear them in the workplace. You should just be aware that under Osha regulations, if you allow for voluntary use of respirators, there are certain things that you have to do as an employer. You have to basically make sure that that person is not going to hurt themselves with that respirator. So there's a certain level of training and screening that has to be done if you allow people to wear respirators in your workplace.
Environmental cleaning, it is both an individual and a professional task. Usually the safety plan involves some sort of guidance on how to identify high-touch surfaces and how to base your risk assessment on the impact and frequency of using or touching a surface. Before you engage in cleaning, you have to choose the right chemical. So basically we focus on the 3 C's, the right chemical, the right concentration, and the right contact time. And what we mean by the right chemical is a chemical that is EPA approved. And there's the EPA List N, which includes all the chemicals or disinfectants with claims against emerging viruses and SARS-CoV-2. So these include hydrogen peroxide, maybe ammonium chloride-based disinfectants. We should also make sure that how to disperse and apply these disinfectants. Is it safe to spray the disinfectant, or should we dampen a cloth and wipe surfaces with it? The right contact time, it is on the EPA website as well, and it is on the manufacturer's instructions label. These can range from 1 minute to 10 minutes. The right concentration, so we have either ready to use, or you see it labeled as RTU, where it doesn't require any dilution, and you have the full concentrate, which requires some sort of dilution before you use it. How to clean and disinfect. So there's difference between cleaning and disinfection. Cleaning is actually wiping any kind of soiled surfaces or items, removing the dust or grease. And most importantly, when I actually see any visibly soiled surface before you apply the disinfectant, because if you apply the disinfectant on a soiled surface, you're actually protecting the pathogen from that disinfectant, and it renders it ineffective. So after you do the cleaning, you apply the disinfectant either by, of course, following the manufacturer instructions, either by spraying or by wiping. Now, it is important that if you decide to hire an outside contractor, professional janitorial services, make sure that they follow, they communicate their cleaning and disinfection protocol. And whenever you are responding to a COVID case, make sure that the cleaning process is being monitored and documented.
I just want to emphasize 2 really, really important things that Malek just said, and these came up with clients this week. One is, how often have you seen your janitorial staff with a bottle in one hand and a rag in the other, and they spray and they wipe, right? That's how we clean things. It's not how we disinfect. For disinfection, as Malek mentioned, we may need to keep that product wet on the surface for as much as 10 minutes. So you've got a spray, you may have to reapply to meet that 10-minute contact time. And the other thing is just health and safety related to dilutable chemicals. Some of these disinfectants in their concentrated forms are can be very dangerous. They can be very corrosive, and I've seen where people have applied concentrates without diluting them, and it's resulted in serious skin burns. It can blind people. So really make sure you understand the chemical you're using, and if it is dilutable, that it is diluted correctly. You also don't want to over dilute it, or you're not going to have the disinfection.
Now, when we talk about cleaning high-touch surfaces, we propose some sort of surface infection risk matrix. So there are 2 ways to clean and disinfect, either for prevention or as a response, as we said. If you clean for prevention, then you should clean depending on the likelihood of impact or contamination. So we have proposed a cleaning inspection log, which is mandated by most counties now as a documented effort for cleaning and disinfection. And it includes the type of surface or area you are cleaning and disinfection, the infection risk based on impact and use, and the cleaning protocol. This is important. So you have to mention what cleaning protocol you used during the process, what chemicals you've used, have you sprayed, have you wiped, and there's no actual recommended frequency of cleaning, but as much as needed is the recommendation and where the resources permit. So high-touch surfaces are examples of that. Could be doorknobs, tabletops, commonly used equipment, control panels, communal items in the kitchen, the coffee machine, the microwave, and other similar items. Now, Dave will elaborate more on the case response and the contact tracing element.
Sorry, I got a little heavy with the slide there.
Oh, that's fine.
So, case response and contact tracing. What do you do when somebody either becomes sick or has been exposed to a known or suspected case of COVID-19? And this gets really complicated really fast. So let's just start with a few definitions. So what's a known or suspected case? Well, that one's kind of easy. It's somebody who either has symptoms or has tested positive. Now we'll talk about symptoms in just a second because that's the complicated part. But what is an exposure defined as? CDC says for purposes of evaluating exposure, it probably makes sense to use somebody who's been within 6 feet for more than 15 minutes. So the important thing here is an exposure isn't walking by somebody in the hallway necessarily, right? It's having close contact. So either we had a close conversation, maybe I gave you a hug or a kiss, but again, there's nothing magic about that 15 minutes. If the person you're exposed to sneezes in your face, right, then that 15 minutes kind of goes away. You may have been exposed in a much shorter period of time if somebody, in that kind of a case. There's a lot of, CDC has a whole website about this, but the important thing to think about here is, have you been exposed within 6 feet for more than 15 minutes to somebody that either has tested positive or has shown symptoms? Now, symptoms, as I mentioned, challenging. Some of these symptoms are obvious, right? Fever, cough, shortness of breath, loss of taste or smell. These things are not specific to COVID, but pretty obvious. It gets a little more challenging with some of these other things. A sore throat. It's smoky outside. We have wildfires. I have all kinds of sore throat issues right now just from breathing the particulate. Same with congestion and runny nose, right? I know when I go outside in these fires, I get a little congestion. Nausea and vomiting, diarrhea, these things can be related to food issues. So just because somebody was exposed to somebody that had a runny nose doesn't necessarily mean they've been exposed to COVID. This is the line we have to try to figure out as employers. And we'll kind of walk through what that looks like. So there's several steps in responding to a known or suspected case. A lot of this is related to documentation. We want to, as employers or building owners, we want to document what did we do with that employer when they reported to us or their supervisor or to HR that they had symptoms or they tested positive. One thing we want to do is respond immediately. There's certain things we need to do right away, and then there are certain things that we need to get done in the slightly longer term. But all of this should be documented. Here's just a quick example of what that documentation may look like. You want to know, where does this person work? Are they actually reporting a case, or did they test positive? I'm sorry, are they reporting an exposure, or did they test positive? When was the exposure? The dates become really, really important here. When was the person last in the building or the area? All that needs to be documented to make the next decisions. Here's kind of a rundown of how it works. So we expect that an employee who comes down with symptoms or tests positive knows and is going to notify. That notification may be their supervisor, it may be HR directly, it may be some other path, but people need to notify if they've had symptoms, if they've tested positive, particularly if they've been in a building or around other people. Somebody needs to address that person, tell that person what are the next steps. You need to leave, you need to go home. Depending on your symptoms, you may need to seek medical care from your physician. You may provide them with, references to some of the guidance put out by CDC. If a known or suspected case has been around other people, those people need to know. That's the basis of contact tracing. That's how we stop the spread. Is if Malek showed up with symptoms, I was around him, I hope somebody would notify me that I may have been potentially exposed to somebody so that I can then quarantine. From an environmental standpoint, we need to look at where that person has been. I'm going to continue to use Malek as my example here. So if Malek had symptoms and I can see now that he's in the office, I need to know when he was in the office and where he spent his time. If he was in that conference room, I want to shut the door on that conference room for at least 24 hours. We don't want to do anything if a sick person has had prolonged contact in that area. So step one, shut down the area. But then we need to address it. We need to do some cleaning or environmental disinfection. And the reason why we shut down the conference room, by the way, is we don't want other people going in there. These things are airborne. We don't want to expose people. So to the extent we can, we want to isolate the area for 24 hours, increase outdoor ventilation, maybe open the windows if we have that ability. And then we're going to do some cleaning. The 7 days becomes an important number. CDC says if a known or suspected case was in an area within 7 days, then it's appropriate to do some kind of cleaning and disinfection. So if Malek was in that office, he reported it to me 6 days later, I want to make sure we go in and do some cleaning and disinfection in that office. That may be your in-house staff that does it. You may choose to hire a specialty contractor to do that work, but we need to do some level of cleaning and disinfection. If it's been more than 7 days, I got my slides backwards, sorry. If it's been more than 7 days, CDC says no need to clean. It's been long enough. Surface transmission is not likely to be an issue. So if I don't find out about this illness for more than 7 days, we don't need to do any additional cleaning. And here's some examples of how you may document these things. Again, it's really important that we document all these facts. That's the basis of our contact tracing is knowing who was around other people, where they were at and when. I certainly want to document my response. If the known or suspected case was in an area within that 7-day window, I want to document that I did clean, what I cleaned, what chemical I used, that I maintained the correct contact time, that I diluted correctly. And then the next question becomes, when can that person come back to work? So for somebody that's been in isolation, this is somebody that's either shown symptoms or has tested positive, here are the guidance for coming back to work. So 10 days after onset of symptoms, 24 hours without a fever, not using medicine, and other symptoms have gotten better. And then how does testing play into all this? Testing is really interesting right now. It's not, at least here in California, it's hard to get tested. The results take a long time, but the CDC does say if your doctor's okay with it and you get 2 negative tests 24 hours apart, you can discontinue isolation before that 10 days. I don't know about other areas of the country right now. Right now, test results in California, at least in the Bay Area, are running somewhere between a week and a half, something like that. So getting 2 negative tests 24 hours apart isn't a reality right now for a lot of people. Isolation, the term isolation, that's for people that are sick. Quarantine, which we're going to talk about, is people that have been exposed to somebody that was sick. So if Malek was sick and I had close contact with him, I would then be quarantined for 14 days, whether or not I had symptoms. And that's because symptoms can take between 2 and 14 days to manifest following exposure. And then, can I test out of quarantine? No. CDC says you cannot use test results to test out of quarantine. So even if you get 2 negatives in 24 hours, the current guidance is that doesn't matter. You've just earned a 14-day break from work if you have been exposed to a known or suspected case. What I found in doing a lot of these case responses is that more often than not, they're not clear cut. They become really complex really quick. What happens if I was exposed to somebody that was exposed? Well, you can follow that logic, follow that chain, and there is some risk there, but that's a second degree exposure. It's not an exposure as currently defined by CDC. This is one I had recently where somebody, their wife had traveled and they came back from a cross-country trip. They had a little bit of congestion and runny nose. The next day they got better. So, cross-country trip in a plane, dry air, congestion and runny nose is not a surprise, and it resolved. But now that's somebody that's had COVID symptoms. So do they have to wait for 10 days before they stop their isolation? It's not clear. If they've got a common symptom that resolves very quickly, and they can attribute it to something else, then maybe that's not an exposure. What about wearing masks? Malek was sick. We were in close contact, but we were both wearing masks. CDC doesn't care. CDC says if you were within 6 feet of somebody, known or suspected, for more than 15 minutes, regardless of mask use, you have now been exposed. And then this is a real common one too, is when we do this tracing, this contact tracing, did you follow the safe work practices? And a lot of times it's like, well, I think so. I mean, I wore my mask. I don't know if anybody cleaned the coffee maker before I touched it. There's a lot of gray area when trying to evaluate these things. And here's just a quick example. So somebody that had close contact with a known or suspected case, here's their 14 days, right? They get a 14-day quarantine. In this other example, what if in my example where somebody came back from a cross-country trip and they had a runny nose, that person, they get their 10 days, right, until they can leave isolation. But what about somebody living with them? Their 14 days doesn't start until the end of the 10 days for the first person. So if I live with somebody who's a known or suspected case, who may have symptoms, I may have 24 days of isolation in my future. So there's a lot going on here. I'm running out of time, but I'll just hit really quick on communication. This is a huge issue. There's so much information. There's a lot of misinformation. As employers, we need to be communicating to our staff what they are required to do to keep everybody safe and why these things that we're doing will keep people safe. As visitors come into our building, whether it's the public or other types of visitors, they need to know what to expect. I have a dentist appointment today, and my dentist called and said, this is what you can expect when you come to the dentist. And that's very important so that I'm prepared to deal with whatever his safe work practices are. Vendors go from site to site to site oftentimes, so they can be a risk for transmission. And then communication to the public, maintaining confidence with the people that rely on us, the people that visit our sites is really important. So communicating what we're doing to protect you, I think, is a really important part of the communication piece. And then I think I'm at my last slide. So to sum it up, this is a public health issue. The solution relies with the public. We need to change people's behaviors, and that's really hard to do. We need to do that. We need to train. We need to reinforce. We need to audit. We need to slowly get people to move in the direction we need them to move in. It's also important to know that there's no silver bullet. We've talked about a lot of different safe work practices today, and all of those things need to happen together. That's what really reduces the risk. We can't just wear a mask without maintaining personal distance. We can't just have a plan but nobody follows. We got to do all these things in order to reduce the risk. And then be prepared to adjust and pivot. Things are changing all the time. And again, what I say today may be different tomorrow. So keep up to date on all these things. And with that, I think we've got a few minutes to answer questions. Taylor, do we have any
Yeah, we've got several questions that have come in. The first one being, how will building safety inspections change given this new world of COVID for the inspector?
I don't know if we're talking about building inspectors or other kinds of inspectors, but this goes to that discussion about visitors and vendors entering your buildings, right? When I go, I am an inspector, and I go into buildings all the time, and so I need to know what's required of me. Oftentimes, I'm being asked to sign a waiver or to sign something saying I know what their safe work practices are, or I have to provide what my safe work practices are to them to review. So I think it's a lot of communication. It's being prepared to deal with all these different practices in different environments.
Okay, next question is, where does the 30-foot outdoor social distancing rule come from?
Somebody made it up. That's a great question. Where that comes from is somebody determined that 30 feet was a good distance. If you're walking down the street, that gives you enough time to reach into your pocket and put on your mask. So that 30 feet has nothing to do with infection prevention. It's just a practical consideration that I can see somebody from 30 feet away, and that gives me enough time for both of us to put our masks on before we get close.
And what is your recommendation on Gator face coverings?
Yeah, this is a really interesting one. Malek, I don't know if you have a thought. I read an article just yesterday on this. There's conflicting data, right? Some data out there says, oh, Gators aren't as good as a cotton mask, or aren't as good as a surgical mask. I saw another study that said if you double up your Gator, it can actually be just as effective or more effective as some of these other things.
Depends on the layers, Dave. So the more layers you have, the more. I mean, it doesn't give you protection. It gives us the other persons. I mean, the public. So the more the closer the layer is to your mouth or nose, the more protection it gives to the public. This is why a face shield gives you short-term protection, but not long-term protection, because of the gap between your face and the plastic.
Yeah, so more layers, the better.
Okay, and when applying EPA-approved chemicals, are there any concerns of chemical exposures to occupants or workers? And do we need to monitor for those chemicals under OSHA regulations?
Yeah, without a doubt. And I gave an example of that. OSHA requires that we communicate hazards to our employees. It's called the HAZCOM standard. So whenever your employees are dealing with a hazardous chemical, they have to be notified about that. They have to be trained. SDSs, safety data sheets, are a good place to start when evaluating safety concerns related to disinfectants. But certainly dermal concerns can be an issue. These things can be rough on your skin, so wearing gloves while using disinfectants may be needed. And then also you'll see a lot out there about spraying or fogging chemicals. To me, that's probably the bigger concern. Whenever we take a chemical and we aerosolize it, now I can breathe it in. And so some of these chemicals are pretty nasty. So if you are going to or fog chemical, you need to make sure that is the approved use on the label. You cannot legally spray a chemical or fog a chemical unless it's been approved for that use. And partly that's to protect people from the chemical.
All right, and last question, how would you check if an employee did the CDC self-checker if used in place of having the employee answer questions and take a temperature? Yeah, so that's, if you're going to rely on the self-checker, you just have to rely on the fact that the employee's following the rules. And you can ask them to verify that they've done it. You can say, I need you every day to sign this form saying I've done the self-checker, or call your supervisor saying you've done the self-checker. But if you're going to go that route, you really are relying on that person to do the right thing, which is the same for a lot of these controls, right? I rely on people to wash their hands after they use the coffee pot, or before, after they leave the bathroom, before they use the coffee pot. I'm relying on people to do the right things outside of work. When I work with my coworkers, I need to trust that at the end of the day, when they go home, they're still practicing safe practices. So, as you said, this is a public health issue. It takes the public to solve this problem, and we really all need to be doing these things every day in our life, both personal and at work.
This is the difference between prevention and control. So when we show the diagram of the prevention, control, and containment, so controls are something an approach that you can audit and monitor, and you can enforce. However, prevention is the individual effort. So as you said, you cannot monitor people washing their hands, practicing hand hygiene, or self-checking at home. So you have to rely on you have to trust the employee of doing that individual effort.
All right, well, we are out of time for today, but there are several questions that we didn't get to. I will work with David and Malek to make sure that they can answer those, and we'll send those to you privately. We will also be sending out a recording of this webinar tomorrow, so keep your eye out for that. And with that, that concludes today. So thank you, David and Malek, and thanks everyone for attending.
Thank you, Taylor. Thank you, everyone.
Great rest of your afternoon.
Thanks all.